Welcome to the Wellness Track. My name is Dr. Jeanette DeWitt. I'm a doctor of physical therapy, and today I wanted to answer the question, can the neck cause headache and migraine symptoms? Absolutely. That is a resounding yes. The reason that the neck can create headache symptoms is because the joints in the cervical spine can get tight or be pulled in a direction that they do not want to go. That is when somebody experiences a cervicogenic headache. Now, what exactly does a cervicogenic headache look like? The person will often describe symptoms of a headache on one side. It's not like a headache that feels like it's compressing on both sides. It's typically one side only, but it can be anywhere on the head on that side. So someone may experience it in the back of the head, on the side of the head, on the top of the head. That doesn't matter in regards to location, except it tends to be unilateral or one-sided. The other thing that is unique to cervicogenic headaches is that it's typically joint related. So even though it's not muscular related, the muscles can indirectly influence the joints because muscle attaches to bone, and with your vertebrae you have a bone on top of a bone like this stacking. So you have 7 cervical vertebrae, C1, C2, C3, C4, C5, C6, C7 bones, and you have joints in between each level. Those joints are called facet joints. When muscles are tight, they pull on their bony attachment and influence the joint itself. We can help to relieve the joint pain or the cervicogenic headache by calming down the muscles. And that can be done in a couple of ways. Either someone moves the muscle and helps it relax, or you move the muscle and help it relax. I typically prefer people to learn how to relieve their own symptoms. So what I try and teach people is how to move in yummy movements, because who wants to move in yucky movements and make things hurt worse? I teach people how to move in a yummy position that feels good, so that they don't feel like they're hurting themselves every time they try to move. I also try and teach relaxation techniques as well as self-massage or self-trigger point releases to calm the muscles down. And when those muscles are relieved of tension, when the muscles are more symmetrical, meaning they're not pulling against each other, then we get this lack of tension, and that lack of tension stops pulling on the bony site, which then allows the joint to calm down. And then guess what happens? The headache goes away. And that's ultimately what we want. If this makes sense to you and you want to connect with me, go ahead and just look around the site and find out my information, connect with me directly. I'd be happy to help you and walk you through some steps to relieve your symptoms. Headache pain can be caused by neck issues. That is typically called a cervicogenic headache, and it's just one of the reasons people may experience a headache. I hope to chat with you soon. Thank you for tuning in. Take care.